Welcome to the She Found Motherhood podcast. Today, I have the absolute pleasure of chatting with Nicole Rendawa. Nicole is a pelvic physiotherapist and mother of one. She shares with us her journey from pre-fertility through pregnancy and postpartum. We'll get right into the podcast and her birth story after this quick message. Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Good morning, Nicole. Welcome to the She Found Motherhood podcast.
Thank you.
I'm so excited that you want to share your birth story. And I thought maybe we could start by asking you to share a little bit about your fertility journey and what got you to your pregnancy.
Yeah, so my fertility journey started in 2019. So what ended up happening is I had an ovarian torsion and no one really knew what was going on. I guess I wasn't displaying like the classic symptoms of it. And so anyways, I ended up going to see a physician at PCRM in Vancouver.
Yeah.
And it was Dr. Caitlin Dunn, and she's the one who ended up diagnosing the torsion. And long story short, I ended up going into surgery to untorsion it, and the ovary ended up being okay, which was great. But there were two big teratomas on each ovary. And so because of that, we decided to go into do some IVF cycles to preserve fertility before we tried to remove those teratomas from the ovaries, along with the fact that I had a low AMH level, like very, very low. And that was kind of another concern. So anyways, then I was spending a lot of time in Vancouver doing those 3 cycles. The first one was very disappointing. We didn't get any embryos from it.
Oh, yeah.
Yeah. And so that was quite a surprise. I know everyone has different outcomes with that, but it was pretty upsetting. And then the second 2 cycles went okay. And so anyways, by the end of it, we ended up with 3 healthy embryos, but we were still advised to try to conceive naturally before we tried to use those embryos. And so we tried to conceive in 2022, and it actually happened on our first cycle, which was
very uncommon.
Shock.
Yes. I was like, I'm like, listen, attention listeners.
Exactly. And considering that we had the low AMH, and I know that isn't necessary, it's just a marker. It's not but in my mind, I guess I was expecting it was going to take a long time. And honestly, I just thought we were going to have to use the embryos. I didn't think that we were going to be able to do it naturally. So that was a complete shock, but obviously we were very grateful that that's what happened. And and so I got pregnant last November, and not last November, but it was November before.
2021.
Yeah. Oh my gosh, the time. Yeah, it's all jumbled in my mind. But and at the beginning of the pregnancy was uncomplicated. And honestly, most of my pregnancy was uncomplicated. The only thing that popped up was I ended up having GDM, so gestational diabetes.
Yeah.
So that was just something that we had to manage. And I ended up being on insulin towards the end of the pregnancy to help me manage the blood sugars.
Yeah. How was that?
It was fine, given the fact that it wasn't a huge complication. I think it just made me feel initially like, I guess I perceived myself as being like a pretty healthy person. Like I was still active and I was still eating well, but diabetes runs in my family. And so I think I was just a little bit surprised by it. And then of course that feeling when you end up being on insulin is kind of that guilt, like you didn't try hard enough, even though that's not true. And I know that's not true. And I've heard the podcast that you guys talked about that, and that was really helpful for me to hear. But it was a little bit of that, and then it was fine.
We're so hard on ourselves, aren't we?
I know.
Right?
I know.
Even when you know it, you're a
Yeah.
physiotherapist, like you're a clinician, you understand evidence, and yet,
That
you know,
emotional piece just, yeah,
yeah,
it's hard to override
yeah,
sometimes.
yeah.
hmm
So tell us a little bit about how things went towards the end of pregnancy and into getting ready for birth.
Yeah. So I was working with Grow as my,
Okay.
yeah,
Yeah.
my care team. And so that was great. And I ended up taking the course as well, the She Found Motherhood
Oh, yeah.
prenatal course. So that was the only course that I took to prepare me. And that was sufficient. We felt like it was everything that we needed. And so that was helpful. Like my husband and I would watch it whatever amount of time that we had at the end of the week. And then we pause and chat about the videos and work through it that way. And so that was great.
Amazing. Amazing.
Uh,
And that's why this is not turning into an advertisement for our course, but we know how hard it is for people who work and your evenings and weekends are precious. So to be able to just watch it when you choose and you can watch it together, you can rewatch it. And we got put a lot of content in there. Yeah.
Definitely. And that was one of the reasons we decided to take that course as well, was because we live in Mill Bay. And so we're not in Victoria.
Oh,
It's
yeah.
not really convenient, yeah, for us to be able to do that. My husband worked like long hours. And so we needed something that was going to be virtual
Yeah.
that we could do
Amazing.
together. And so, yeah, it was
Yay.
great. And then we also hired a doula. So we
Oh,
worked with
perfect.
Sarah. Yeah, Sarah McCabe. And she was wonderful. And she came to the house a few times and we chatted and got to know each other and talked about, yeah, what labor and delivery was going to look like and kind of early postpartum.
Amazing. And so going in, did you have something Alicia and I talk about is like birth preferences or plans? So did you have an idea of how you wanted things to go, or you hoped things would go, I would say?
Yeah, yeah, definitely. And doing the work I do, I know very
Yeah.
well that all sorts of things can arise
Mhm.
throughout birth. But yeah, of course, my ideal would have been an uncomplicated vaginal delivery with no instruments and
Mhm.
minimal tearing.
Yeah.
Would
Yeah.
be
I mean, that's everybody,
yeah,
not to,
exactly. No, for sure. But no, I guess my plan was that we would try to labor at home and then we would make our way to the hospital once we felt like we were approaching active labor. And then once we were in the hospital, I didn't have a plan about epidural or no epidural. I was just going to see how I was
Mhm.
managing the pain.
Mhm.
So yeah, so that was what my thoughts were. And then in terms of instrument use, I was okay with a vacuum. I really didn't want to use a forceps.
Yeah. Nobody
And
does.
yeah, and so I was kind of like, if it's between a C-section or a forceps, I'd almost rather a C-section. But yeah, I know it all depends on baby's position or station and all that type of stuff.
Yeah.
Which
Yeah. But, and you know what? That is like very, very common, especially going into birth. But then once you're in it, it's a different story.
exactly.
Yeah.
And some of that actually ended up happening, and some of it didn't actually end up
Yeah.
happening. So I ended up needing to be induced, which what I found really helpful with the course as well, because you guys have a whole section on induction
Yeah.
and the different methods, and that was
Oh,
super,
good.
super helpful. Yeah.
Amazing. So did you get how far did you go post dates, or was it diabetes related, your induction?
It was the diabetes related.
Yeah. Which
Yeah.
is common,
Yeah.
especially when you're on insulin, right? Because we know
Mhm.
we have to be mindful of how well that placenta is functioning.
Yeah, exactly. And so we were going in for the non-stress test and all that leading up to it. And then, yeah, and then we had, of course, you get on the list for induction and then you're kind of just waiting by your
Ugh.
phone to
Hurry up and wait.
Yeah, exactly.
Yeah.
Every time my phone would ring. Yeah.
I know. I was going to say, before we dive into hearing about your induction, your birth, I wanted to ask, as a pelvic physiotherapist, what did you do to prepare for birth?
Yeah, I think the biggest thing is perineal massage, honestly.
Yeah.
Of course, like I mentioned, like I think just generally staying active as best you can. Of course, it's challenging during pregnancy, but as best you can just for general health. But yeah, pelvic floor specific was the perineal massage. So we would do it. I think I started around 32, 33 weeks, and we would do it every night.
Yeah.
And even as a pelvic floor physiotherapist, like I instruct people on how to do this, and I still that's the last thing you want to do at the end of the day to do a perineal massage, but would highly, highly, highly recommend, because I could even just feel the difference between when we first started and kind of closer to delivery, the ability to let that pelvic floor relax when it comes to that increased stretch.
It's amazing, hey? And you also get yourself used to that discomfort of the stretch, right? And you're able to sort of like relax the muscles, not necessarily your frame of mind, but
yeah. No, that's exactly how I describe it to my clients, is that that's what we're looking for, is that you're going to feel that increase in stretch. It can feel uncomfortable. And the whole goal of it is to try to relax in response to that discomfort.
Yeah.
And then talking about different techniques in terms
Yeah.
of how to do that.
Yeah.
I would say that was probably the biggest thing that I did during pregnancy that was helpful. And then of course, just like stretching.
Yeah.
Yeah.
Keeping your body, like your lower body stretching.
Yeah, exactly.
Amazing. So tell us about your induction. How did that go?
Oh, can I just say one more thing?
Yeah,
On the
of course.
I just totally forgot. I was like, what else did I do? A couple of other things that I did is prepping ice, like those ice popsicle.
Yeah. Oh, yeah.
Things. Yeah. And so honestly, I was like, am I really going to need this? I don't know. But I was just trying to kill time too while I was on the induction list and finding things to do. I made a few of those and those were amazing. I would highly recommend.
Yes.
Yeah.
Yeah. And I think we have a video on how to make them in our course.
Oh, amazing.
Yeah. Yeah. And it might, I made it not that long ago, so it got added to that. Yeah. So people know how to make them, and make them beforehand, because you're not going to feel like making them after.
Absolutely not. No, I was so thankful that I did it beforehand and that I had bought your typical like large pads and and all that type of stuff.
Yeah. Amazing.
Yeah.
So induction, how did things go down? You eventually got called, I presume.
yeah. Eventually got called and we make our way down there and they wanted to use a cook catheter. And from what I had heard about the cook catheter is that they pop it in and then you can go on your way and maybe have a good night's sleep and all of that kind of stuff. And so that's kind of what we were expecting. And we got it inserted, which was fine. And then I'm thinking that we'll go and get something to eat and then head home or whatever. But for me, what ended up happening is that it took me into active labor essentially. So I got home and it just kept increasing in pain to the point where I wasn't able to talk anymore. And we ended up having to call the hospital and just kind of figure out what we should be doing. So we ended up back at the hospital. I got a shot of morphine and they actually decreased the amount. I don't know the technical terms here, but the amount of water.
Yes, in the balloon.
Different amounts that you can. Yes, exactly. And so there was the max amount initially, and then they kind of took it back a little bit.
Yeah.
And that immediately stopped the pain and discomfort that was happening. So
yeah.
Then
that
we
happens.
ended up going. Yeah. So we ended up going back home, and then it was fine. I was able to sleep. It was great. Woke up the next morning. It wasn't coming out yet, and so we're walking around. We come back from our walk and it came out. And so we are just approaching that. I think it's 24 hours so we're just approaching that mark and it's so busy. I delivered in August and I guess it's a busy time. And so what we were initially talking about was that I would just go back home and they would just call me in when they had time or room, I should say, when they had space for me to come back in. But then they went and did the cervical check and I was actually 5 centimeters dilated.
Oh, good for you.
At that point.
Yeah.
And since we live in Mill Bay, right?
Yeah.
And so our physician there she was like, I don't want you going back over the Mount Hat. And luckily we had a place to stay in Victoria. So she's like, stay in Victoria because you may need to come back in sooner rather than later.
Yeah.
Okay. So we left the hospital. We're driving back to my mom's place. And on the ride back, I'm like, I feel like I'm having contractions again. And so we got back there and we probably spent 10 minutes at my mom's place before we had to call the hospital again because we were again in that active labor stage. So called, came back into the hospital and then that's where the rest of it started.
Yeah, that's amazing. And that can happen, right? The cook catheters, like that, we call it mechanical, like they just stretch. And it can put some people into labor, not often, but if we put enough water in it and really get that stretch going. So amazing. Yeah. Your body
I think I
do.
just,
yeah,
exactly. And knew what to do. And I'm thankful that it did. And it wasn't more of a drawn out process, but I think I just wasn't expecting
No,
it.
because we usually prepare people that I'm like, it's going to take a number of days because it often does. Yeah. You got to hospital and tell us how that went.
Yeah. So I got to the hospital and I was having back labor and it was kind of intense. So my doula came and met us there, and actually one of the things I found really helpful was that she had a TENS machine, and so we popped that on to my back. Yeah, and that was actually quite helpful for me in terms of managing the pain. But we ended up I ended up asking for an epidural around the 7 centimeter
Mm-hmm.
mark. And so we got the epidural put in. And this was another complication that is very uncommon, but I ended up with Horner's syndrome.
What?
Yes.
That's
And
crazy.
so what ended up happening is he put the epidural in, and then you know how they lay you back and sort of thing. And I felt my eye starting to droop. And so my husband's a physician, so I mentioned it to him. I'm like, I don't know what's happening here, but my eye's starting to droop. And so he takes a look, and anyway, so we ended up getting the anesthesiologist to come back in, and he was also, I think, a little bit maybe surprised. I just think it's not a common thing to happen.
No,
So kind of
I've
like,
never
oh
seen
my
it.
gosh.
No.
Yeah. And what we ended up deciding to, and this was where I found the doula support like very, very helpful, is that even though we both, my husband and I, come from, you know, healthcare backgrounds, in that moment, you're still the patient, and you're feeling scared and kind of what is going on, and you're not able to think with that same clear mind. And so what was really helpful is, as the anesthesiologist was talking to us, it's like he was saying words, but like I was not able to really comprehend everything that was happening. And so Sarah was able to, once he had stepped out, was just kind of able to reiterate what he had already said and suggested maybe a few questions that I should ask the next time that he came in. And so that was very, very helpful. And so when he came back in, we made a plan about what we were going to do in terms of the epidural. And so we decided that we didn't want to take it out, because what he said is that if we put it back in, likely the same thing was going to happen. And so he just decreased the dose.
Okay. I don't even know the pathophysiology behind how that happens. It's so bizarre.
It's so bizarre. I might butcher this a little bit, but what he basically explained is that the epidural went into the sub-epidural space, which is basically like no space really. And so it kind of opened up that space, and that's why he didn't want to
potential space,
it.
right?
Yeah, exactly. That's what I'm looking for. So that's why we didn't want to reinsert, but I didn't want to take it out. So we just decided we'd leave it in. For me, it wasn't that big of a deal once I understood what was happening.
Yeah.
I think it was just nerve-wracking.
Yeah.
Not expecting it to affect my face, and then having my face be affected.
Yeah.
Initially.
Yeah.
So
you're already so vulnerable. You're already so vulnerable
Yeah.
when you're in labor and you have no control over what your body's doing. So that to then have that layered in definitely complicates things.
Absolutely. And something that you've never really, you hear the typical epidural complications when you're giving consent, but just very unexpected. What ended up, so anyways, we ended up getting to 10 centimeters.
Did the epidural work? Though? Yeah. Did it give you some relief?
It did give me some relief. And honestly, I liked that it was kind of I don't know what it's like to experience the full dose, but the amount that I had, which was a lesser dosage, was helpful because I was able to still feel, but not to the same extent that I would have been able to feel without the epidural at all. So that was actually very helpful. And so we ended up getting to 10 centimeters around 5 a.m. And then we labored down for a little bit until we absolutely did start pushing. And pushing was 3 hours long. Yeah.
I can relate.
Yeah.
That's how long I pushed with my first. Yeah.
Oh, really? Oh my gosh. Yeah. It's a long time. But we ended up having an OB come in. I think it was Dr. Wong, and she was amazing.
Oh, she's lovely.
Yeah, she was really, really lovely. And she basically, as we were going through the process, like coaching me through, and my husband, you push better when she was in the room than you did when she wasn't in the room. It was almost kind of like he gave me that like extra motivation to be like, hey, I can do this.
Yes. Yeah. So like, come back. Yeah.
Yeah, exactly. So she at one point we talked about the vacuum, which was fine. We gave consent for that. And then at one point she was like, I don't know, we may actually need to use a forceps, or the other option is C-section. And so then at that point, I said I would prefer a C-section over the forceps. And then we didn't end up needing to go there though. So I was able to get him to a point where we were able to use the vacuum effectively. And he did have a shoulder dystocia. Yeah. But she has magical hands. She was able to just
and I think we talk about that in our course. So
yes,
people
you
don't. It's one of the scariest things that can happen if you don't know what's happening.
Yeah, exactly. That was definitely one of the things that was helpful as well. And that's the thing, because I knew more information about it, but it didn't feel as
you don't feel as like out of control of your own body.
Exactly. And yeah, so then he came out and I had just a very minor first degree tear.
With a vacuum. Way to go,
Yeah.
perineal massage.
Yeah. And that's when I'm like, with my own now lived experience,
Yes.
it was very, very helpful to have
You'll
that.
shout it from the rooftops.
Yeah, exactly.
Oh, amazing.
Yeah, but he came out and he wasn't crying, and that worried me because, you just want to hear that initial cry, but they ended up having to, he had some fluid in his lungs, so they ended up having to, the peds team came in and got that out, and then he did well after that.
Good.
Yeah.
And that's also really common, like needing a little bit of resuscitation and help transitioning, especially after long labor. Like it's tiring for them too.
Exactly.
But again, it can be really scary when your baby comes out looking more blue than pink.
Yeah, exactly. And of course, all you want to hear is that initial cry because it feels like an indication that things are okay.
Totally.
But
Totally. We want to hear it too.
I know exactly, right? I remember it so clearly because he came out and they put him on my chest and I was like, why isn't he crying? And then of course the peds team, the room just gets so full so quickly.
It's like a birthday party. Yeah.
Yeah, exactly. And so they took him over to get the fluid out of his lungs. And so anyways, my husband was making his way over there because we had talked about this before as well. If something happens with baby, I wanted him to go with baby and not stay with me.
Yeah.
So he's making his way over towards the baby, and it felt like he was literally sauntering over there. Like it felt so slow to me. And I just remember, I didn't yell at him at all throughout the rest of it, but I remember yelling at him and be like, get over there and tell me what's happening.
Hurry up.
Yeah, exactly. And then we were joking about it after because there's just so many people, I couldn't make my way over there. But anyways, yeah. So
it's too funny.
Yeah.
Exactly. So how did things go immediately postpartum with your bleeding and feeding and all that kind of stuff?
I think bleeding was to be expected. I didn't have any postpartum complications in terms of bleeding or anything like that, which was great. So that was to be expected. Feeding was definitely a challenge for me. I tried to go into it with the mindset of I definitely want to try to breastfeed, and I tried to educate myself beforehand. There's some information in your guys' course, and I also I think you guys had done a webinar a while ago.
Yes.
It was like and so
preparing
we had taken
for
that as
feeding.
well.
Yeah.
Yes, exactly. Yes. So we had done that as well, and then we also did a course through Mothering Touch that talked about breastfeeding. But yeah, it was a challenge. So just trying to get him to latch, and it was painful, and we ended up getting there, but he also had jaundice, and so trying to get him to be alert and wake him up for a feed was like so sleepy. And so we would have to undress him and try to kind of tickle him and try to get him to latch onto the breast. So I think that also complicated things. So what we ended up doing was topping up with formula. And so we did that basically when we were in the hospital. We started topping up with formula, and then we continued that throughout. And I was also pumping. So I was essentially triple feeding, I guess is what they call it. So breastfeeding, topping up with formula, and pumping. And that just kind of takes all of your time.
All of your time. Yeah.
Yeah, exactly. And I think that was actually, I don't think I recognized it in the moment as much as I do now looking back on it, that was quite challenging mentally.
Yeah. Oh yeah. I think it's something that we don't talk about commonly, and we should talk about more, but when you have breastfeeding difficulties, it increases your risk for having symptoms of postpartum depression and anxiety. And if you've been through a challenging breastfeeding experience, you can understand why.
Absolutely. And, it's funny, even though I felt like I tried to prepare myself with education, but also with the mindset of, if it works, it works. If it doesn't, I'm okay using formula. It's, again, that kind of emotional side that comes out that makes you kind of feel like it's something that you didn't try hard enough, or it was your fault, or these sorts of self-blame things. Yeah. Looking back on it now, you can have a little more perspective. Yeah, exactly. It was kind of the exact same thing as that, where it's just that kind of, But yeah, so we ended up doing that. I think I did the breastfeeding and the pumping until December, and then we stopped. And then we just have been doing formula since then.
Yeah. And how was that sort of journey for you, that transition from breast and express milk to formula feeding?
I think what ended up happening is that my supply started to drop, and I don't know. Again, looking back on it, I'm like, was it something that I did? Was I not? Like, I was very regimented when I first started pumping on trying to stay on the schedule, but as RO, my baby wasn't sleeping as much. He was more active. It was harder for me to stay on top of the schedule that I had kind of made. And so I think I ended up missing a pump here or there, and I don't know if that affected my supply. So I ended up getting a decrease in supply. And then it was to the point where it felt like it was almost pointless a little bit to keep pumping because of the amount of effort that it took. And my mind would be elsewhere. I'd be thinking about pumping and that mental health that came into, because it's hard to leave the house when you're having to pump so often.
Yeah.
And at that point, he wasn't breastfeeding. Like, he was just getting the pumped milk. And so it was a tough decision, but I think at that point I knew that it was having my mental health was having too much of an impact.
Absolutely.
Yeah. So then my husband and I talked about it, and of course he was very supportive, and then we just decided that would be that. And it was nice. Like, I was able to leave the house and not have to be so concerned about taking all my equipment with me and my cleaning stuff and all of that, and find a place to pump. And so that was that. And now we've been doing formula, and luckily he took to it really well. And
babies just need to be fed and loved.
Exactly.
And mamas need the same thing. We should ourselves so much, and there's so much out there that makes it look so easy.
For sure. And for sure, for some people it is, and it's wonderful. And for some people it isn't. And I think that, I just wish that I wasn't so hard on myself about it. And I wish that for new moms experiencing the same thing, or anyone who's listening to this, just, it's hard not to blame yourself, but you're just doing the best you can.
Yeah.
And that's all that you can do.
Yeah. We definitely need to give ourselves more compassion and grace as new moms, right?
Yeah, absolutely.
Yeah. So looking back on your whole sort of pregnancy and birth, what's sort of the most unexpected positive memory that you can think of that comes out for you?
Ooh, oh my gosh, there's
so many.
There's so many.
Yeah.
I think, of course, initially finding out that I was pregnant was amazing.
Yeah. Well, I can understand how, after having such like a complicated sort of pre-fertility journey, that what a relief it must have been.
Yeah, definitely. It was definitely a relief for sure. And I think the other thing, I didn't know how I was actually going to feel about breastfeeding, but while I was able to do it, and once we were able to get into a rhythm of it, I actually really enjoyed the experience of breastfeeding as well. So I think that was kind of unexpected for me, but it was a nice moment that we would get together.
Yeah. And what do you think was the hardest thing through the most challenging?
I think, going back to the previous question, I think that the most challenging thing was actually just leading up to pregnancy and having it in my mind already that it likely wasn't going to work. So there's a lot of kind of like anxiety going into it. And oh my gosh, I remember when I would take the 2-week wait, I would just be crazy about taking pregnancy tests, like every single day, even though I knew that was pointless. It was like just that anxiety. Yeah, I think that was challenging. The GDM was initially a bit challenging, but once I got over the mental aspect of it, it was okay. And of course, during labor and delivery, there was the unexpected challenges that came up, but it turned out fine. Yeah.
And look at this guy.
Yeah.
And just thinking about, because you took our course, how do you think that changed your birth experience and your postpartum experience, having that information?
I think that, and this is something I say all the time as well, is it just to be like educated on all the things that could potentially come. So even if induction isn't a part of your birth preferences, sometimes it's necessary for mom and for baby. And so just having that information can really help to calm the anxieties around some of those things. And so having information around that, around instruments that can be used, even that tour that you guys do of the labor and delivery room was just nice to see what environment you may be in. That was really nice. In the postpartum section, I also really like that you touch on a myriad of topics, really. So there's the postpartum bleeding. I think that we could do a whole new thing on this. Early postpartum is just, it's wild. And I feel like you have so much care going throughout pregnancy. And then, of course, you have your few doctor's appointments in early postpartum, but there's so many questions that come up and ahead of time. So you're reviewing it during pregnancy if you're not so caught off guard in postpartum, if some of those things are coming up for you. So I can't remember all of the topics off the top of my head, but I think there was the postpartum bleeding. Let's talk about infant feeding, return to exercise. Yeah.
And relationship, how your relationship changes.
Exactly. And then sleep as well. I can't remember if that was the webinar I took or, okay, it was part of the course as well.
Yeah. I know there's so much. And it's funny because you basically like our whole hope is that we empower people with education to take anxiety out of childbirth. It sounds like we're doing a good job.
That's exactly what I would say that you did. So that was wonderful.
I'm so glad to hear it. Oh my gosh. I'm going to let you get to enjoy your beautiful baby before he pulls your earbuds away. And
he pulled one out, but I can still hear you now.
Oh my God, he's adorable. Thank you so much for joining us and sharing your story. And I think it's just so empowering for people to know they're not alone, whatever their journey looks like, whether it's diabetes and pregnancy or having an unusual diagnosis before you get pregnant, wondering how that's going to impact you. There's so much power in shared experience. So thank you so much, Nicole.
No, thank you so much for having me. And like I said, the birth stories on the podcast were so helpful to me. So I just hope that this is helpful for somebody else.
I have no doubt it will be.
Thank you so much.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.